students. So I'm going to lead today's introduction. We are in the health panel with a variety of awesome professionals that hold a variety of positions within the health field. And with us today to kind of explain what their role is Bradley Ramos, who's a primary care clinical pharmacist at the San Francisco Department of Public Health. We have Harleen Carr, who is a emergency medical technician, EMT. We have Garrett Anderson, who is an orthopedic spine surgery physician assistant. And we have Charite Ricker, who is the director of genetic counseling at the University of Southern California. So we have some awesome people here. We're gonna share a little bit about the work that they do. And as they do, you all are encouraged to ask any questions you have and list them in the chat. And I'll make sure that your questions get answered. If you don't have any questions, then I certainly will, and we'll have the discussion going that way. But if you're here, it's because you're interested, so I encourage you all to ask those questions for our panelists. So to get us started, Garrett, could you elaborate a little bit about the work you do?
Absolutely, yeah. So I am like Michael was saying, I am a physician assistant. A brief background with that is I graduated with my undergraduate in kinesiology, exercise movement and sciences from the University of Wisconsin-Madison. And then have a physician assistant is a master's degree. And I obtained that at Marquette University in Milwaukee, Wisconsin. Shortly after that, then started working at Aurora, which is a provider healthcare network in the Milwaukee area, working in orthopedic spine physician as a physician assistant. The role that I do there is about 50% in the clinic and 50% working in the OR as the physician surgical assistant. Variety of patients that we see have different neck and low back pain, whether it be due to degenerative things or other sort of acute injuries. Discuss with them a variety of surgical and non-surgical options. And then working as the surgical assistant, I am across the physician while he is doing the surgery. So I am assisting with him, being essentially his right-hand man during the surgery.
Super awesome. Thank you for providing that context. Harleen, could you introduce us to the line of work that you do?
Yeah. Hi, everyone. I'm Harleen. So I'm an emergency medical technician, and I'm employed by AMR, American Medical Response. So maybe you guys have seen the big AMR trucks around town. So I'm hopefully in one of those. Right now, I'm completing my trainings with the company. So I'm fully licensed, but because it is a 911 company and we respond to emergency calls, the training process is quite extensive. So even though I'm still in training, I hope to offer you guys some advice about how to go about the certifications. And I've talked a bit with my peers who've been in the career longer, so I have some insight from them as well. And just to give a brief background of my training. So I completed my course completion at UCLA pre-hospital care. And then I took the National Registry EMT test and I passed that. So that's how I became an EMT. And so my plans are to work as an EMT during my gap years before I go on to pursue my future career or healthcare profession. And it's really exciting to be here. This is really a great platform for you guys to learn a lot about other healthcare careers. I'm really excited to hear from the other speakers as well.
Very cool, Harleen. Thank you for sharing that. Bradley, could you tell us a little bit about the work that you do?
Yeah, thank you for having me again. My name is Dr. Bradley Ramos. I am a clinical pharmacist in primary care at the San Francisco Department of Public Health. And what that means is I work hand in hand with your primary care doctors, and we focus on managing medications for things like diabetes, high blood pressure, and high cholesterol. And so we work pretty independently. We have a lot of clinical freedom to be able to make decisions on our own and working as a team with the nurses and the doctors and the other support staff in primary care clinics. For me at the Department of Public Health, we serve a lot of folks who may not have insurance, who may be very vulnerable and may not always speak English. And we provide care even when they may not always be able to afford things. So we often become that safety net for them to still receive healthcare. A little bit about my training. So I attended University of the Pacific and their accelerated pre-pharmacy program. So I entered undergrad as a pre-pharmacy major and matriculated into graduate school for the Doctor of Pharmacy program. After completing that, I completed 1 year of a residency, and that gave me the training to work alongside primary care doctors in the setting that I do now. So thank you again for having me. I'm excited to share this space with everyone. I know we're gonna have some great conversations.
Thank you, Bradley. Thank you for sharing. Charite, could you share with us the work that you do?
Sure. Thanks for inviting me. I'm excited to be here with everybody and not only to share a little bit about what I do but also have the opportunity to learn from the other panelists. So I am a genetic counselor, and genetic counselors kind of serve as a bridge between patients and physicians and other healthcare providers. Genetics can be complex and a little overwhelming, and it's something that most people don't deal with every day of their lives. And so in particular, I work in cancer genetics, so that's kind of my subspecialty. And I see families who are at risk for having inherited types of cancer. And so somebody whose physician or oncology team suspects that they might have an inherited form of cancer will be sent to talk to me, and we sit down and we go through kind of their family history and talk a little bit about what might make their history suspicious, and then if there are any genetic tests that would be indicated, and then I walk them through the testing process, providing education and support, and then also interpretation of those test results, because like I said, genetics is pretty amazing. There's a lot of really cool technologies we have at our fingertips, but we still don't know everything, and there are some limitations. And so we have to kind of go through an interpretive process that looks at the patient's personal and family history in the context of their results to provide guidance to the patient, their healthcare team, and their family members, so that at the end of the day, we're really focused on preventing or finding cancer at an earlier stage. And while I work in cancer genetics, there's genetic counselors that work in all sorts of areas of medicine and in industry. Our training, similar to some of the other panelists, is it's a master level program. So I have my undergraduate in genetics from Texas A&M, Gig 'em Aggies, if there's anybody out there from Texas or follows Texas football. So I did my undergraduate there, and then I moved out to California, where I got my master's in genetic counseling at Cal State Northridge. So it's a cool field, and I'm excited to tell y'all more and hopefully answer any questions that I can. So thanks for having me.
Thank you so much. Thank you so much. And likewise, I look forward to learning a lot and sharing that information with our students who are unable to be here. I think the question that I personally want to know about is how did you realize you wanted to get into this field? How did you realize you want to get into this particular field? I mentioned other panelists earlier, students, that in high school, many students expressed that they want to go into medical field as doctors, as nurses. But as we see with our panel, there's a lot more diversity in the health field than those two professions. So Garrett, how did you find out that you wanted to go into this particular line of work?
Yeah, great question. So I first heard about the physician assistant job and place of work when I was in high school doing essentially a pre-health sort of thing. And in all honesty, it was because they told us you couldn't pick a doctor or a nurse because those were the two most common things, obviously. And I essentially just wrote it off as being, well, there's this thing assistant behind it. And I just said, no, I just want to be a doctor, but I'll just learn about it anyway. And it was kind of interesting. And it wasn't until so when I went into my undergraduate, I was pretty set on wanting to be pre-med. And it was usually about the first year or so, realized that the physician assistant route might be an interesting one. Still pursued the pre-med route though for a few years, but then kind of came to terms after getting further and further along in school, asking myself kind of where I wanted to be 5, 10, 20 years from now. And it was, in 5 years when I was in college, I want to be out working in the medical field. 10 years, I want to be able to have a family and a good lifestyle. 20 years, I want to be, well established in my career and have the flexibility. And while there's a lot of pros about being a MD, there's definitely a lot of backdrop or things that are not as glamorous about it. One, if you are a high school student, being on call is not nearly as fun, and it's not something that is promoted very often, but it's a very real thing. And when you are a doctor, there is a lot of that sort of thing, as well as extra education. So after I started kind of thinking about it that way, did some research around the Madison area, and got to be able to shadow a couple of physician assistants because I was pretty set on wanting to do something with the body. Orthopedics I was drawn to, and quickly realized how similar and yet different being a physician assistant was in respect to being a doctor. There's a lot of similarities in what you're able to do. You're able to see patients in the office by yourself, have your own clinic. You're being able to prescribe medications to patients. And so patients look at you as being this place of authority. And at times the doctor synonym is tossed around to me, even though I quickly say no. But there's a lot of also positives with it that you don't get with being a doctor. When I go home, I don't have my pager on me. My doctor is on his 24/7. If something happens in a surgery, in all honesty, I can go home and sleep at night, and the doctor working with spine is at times wondering, life or death sorts of situations. So there's still a really good work-life balance and getting to be very close to the action, being next to patients and helping, but still getting to have that setting. So that's kind of how things started for me. And more further I got into my college career, found that, yeah, the PA route might be something I'm interested in, and happy I'm in it right now.
That's awesome. Thank you for sharing. From what I hear is you started to consider beyond just a profession, but quality of life, right? Like what did you want for yourself? What did you want? What did you find valuable? And your time is definitely of value, and for you as well, students. Doctors do have that prestige, but they do have those very long working hours.
Yeah,
you
not
mentioned.
only as a resident. I mean, there's a friend of mine that was in the same class, and he's working 100-hour weeks right now, and that's his life for the next 4 years. And even when he's done with school, that's the reality, is that it'll be probably 80-hour work weeks, sort of thing. And so it's a reality that when you're in high school or even in college, there is this glamour behind being an MD, but there is some harsh realities that the glamour can quickly fall away from it. So having a really nice work-life balance is something that, and still getting to be a medical provider is a really cool thing. So.
Very, very cool and important to consider as you're making those choices in your career. Bradley, could you share with us how you arrived at being a pharmacist?
Yeah, if you want the short answer, I was good at chemistry in high school,
Nice.
and I didn't want to be a doctor, but I still wanted to be in the medical field. So pharmacist sounded like the most chemistry healthcare provider. That's the short answer.
Mhm.
But I will say it's a lot more complicated than that. And I want to help demystify this, that it's not going to be one single point in your life that you realize you want to go into something. It's going to be a continuous conversation that you should have with yourself over a long period of time. So it's not so much why you chose to go in it in the first place, but why you choose to continue to do it. So in high school and college, I was very much involved with the community, and uh, I had made the connection that pharmacists are actually the closest healthcare provider. Excuse me, I'm getting a little emotional because it's a very long journey, but very thankful that I'm here. Um, Pharmacists are one of the most accessible healthcare providers in the community. And I absolutely love the community. And so finding that marriage between what I was good at as well as um, what I love to do seemed like the perfect fit. So yeah, and I continue to ask myself if this is something that I want to do, and so far um, it is. So yeah, I'll leave it at that. Yeah.
Thank you, Bradley, and thank you for introducing that point about what you're good at, right? Because many of our students here possess skills that they may not see the value in, but can be very transferable to whatever career they ultimately have, and really make that an awesome career, right? Because they're doing what they like, but they're actually being able to implement those skills that they've developed over the years. Thank you for sharing that. Harleen, how did you go into the field of EMT?
Yeah, so my long-term goals right now are, even though Garrett outlined a lot of reasons why not to pursue an MD, my goals are to go to medical school. But so as a pre-med student, I was, volunteering at hospitals and at free clinics, but I felt like I was kind of there to, it's great to learn how to like interact with patients and the humanistic side of healthcare, but I wanted to play a bigger role in like providing medical care for my patients. So I thought EMT experience would be the best way for me to get that clinical experience that I really wanted, and to really solidify that healthcare is the career for me. And so EMT training, it's the first time I think I've been able to, work so closely with patients. We are literally invited into their homes, and they're trusting us with so much, trusting us with their privacy, trusting us with, handling them with care. And with that trust, it just makes you want to, live up to that expectation and, show them that you're there to really deliver care for them. And I had, and also like realistically also EMT training was like the shortest amount of like training. Like I think the program for me was like, I did an accelerated one that was like 4 weeks long. So it was 4 weeks of training, and then I could do have like a limited scope of practice. There's like certain things I can do with patients, and or even assisting the paramedics with certain procedures that I wouldn't have been able to do otherwise. So EMT experience, it really just opened up a lot of opportunities and to interact with patients more. And I think a lot of other EMTs at where I work, they kind of also talk about it in the same way, where they, got into EMT because they're interested in pursuing another thing afterwards, right? So they're EMTs right now, and maybe they're like saving up to go to school, or they're they're working part-time and they're going to school for like they're going to paramedic school or PA school or even nursing school. So it's a great stepping stone career, and that's what I see a lot of people using it as. But there's also the other side of where people have made it into a career where they do this full time and they're able to support their families and all their needs. So it's a great blend. So people use it as a stepping stone career, and they do it for their, full-time job as well.
That's awesome. So and any student who goes that route is going to have options whether to stay or continue.
Yeah,
Um,
exactly. There's definitely so many options after this.
Yeah, but you saw the benefit in just kind of building relationships with people, and I definitely, anyone who's ever seen a doctor who can make you feel at ease and comfort, we all know the value of that, and so that's awesome that you're preparing to do that. Um, Charite, how did you get into your field?
So somehow when I was in high school, I was in an AP biology class and I heard about genetics and was completely fascinated. So I kind of fell in love with genetics, but I come from my mom's a teacher. I don't know, she taught me to teach, and I always loved teaching. And so I had kind of thought, well, maybe I'll be like a science teacher. Or when I found out about genetics, I thought, oh, maybe being a doctor or a nurse, because again, that's what I thought you did if you wanted to work with people in the hospital setting. Something along those lines was where I thought I was headed. And so I majored in in genetics, thinking I was either going to medical school or maybe I'd be a science teacher. And then in my first genetics class, they make you take a course where it's kind of essentially like, what are you going to do with your genetics degree when you don't get into medical school? And during that course, they were just talking about different careers that a genetics degree could prepare you for. And they mentioned this thing called genetic counseling. And I was kind of fascinated by it because it was like individualized, personalized, and kind of family level education, but very specific to certain situations. And it just seemed like a really good fit. And then during the course of all that, my dad had been diagnosed with cancer. And I remember going to the oncologist with my mom and my dad, and his oncologist saying something like, the future of cancer is in genetics, and like this big ding 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 went off in my head, and I was like, oh, this is going to fix the world, which it doesn't yet, but so I feel like all of those things kind of came together and led me in kind of the right direction, because it is there's probably only about 5,000 of us in the US, so it's a growing career, but a very small one. So I just feel lucky that I stumbled across it when I did, because it, similar to what Bradley said, it took things that I loved and things I was good at and combined them in a way and gives me like that opportunity to, and I'm employed by USC, but I actually work at LAC USC, which is a safety net hospital. So I have the opportunity to do these things within the community that I love, in 2 languages, in Spanish and English, and to really do a lot of outreach that I don't think I would have had in many other opportunities. So it was a little bit of chance and a whole lot of luck, and I'm just grateful I found it. So.
Two things. I'm glad that you said it is a small field, because I had never heard of it. And so I was like, okay, have I been living under a rock? Or is this just not a huge program? A theme that I'm kind of recognizing in you all's stories is the human element, right? The working with people. And maybe we could discuss that just a bit, because I think when we talk about health, we kind of gravitate to the subject matter, right? With medical school, post-bac programs, and chemistry and bio, and it's intimidating, even particularly for those who are maybe not as skilled in those fields. But then there's this really human side of it. And so maybe if you all could share, how the human element helped you gravitate to the health field. And we could begin with Charite, because I was kind of inspired by what you were saying.
A large part of what a genetic counselor, well, actually, I mean, our tools are not the same types of tools as many healthcare providers. We don't tend to touch or cut. That's in the realm of other people's scope of practice. We don't prescribe, we don't. So our tools tend to be things like genetic tests and then interpreting genetic tests. But a large part of what we do is communication. And it's about taking a really complex subject matter. And I mean, if you think about I think about, like, today I was in clinic today, and I saw patients from all sorts of walks of life, and we're sitting here and I'm going through a test result, and it's finding like the way that resonates with that person, that this really intangible, complex topic can be consumed by the average person and hopefully made to be meaningful to them. And so to me, that's even though sometimes what I do can be very similar, like the content or the test I'm using or the final result might be the same across many patients, how you present it and how you work through it with somebody is going to be very dependent on how they learn, what their concerns are, what their kind of personal and family situation is. And to me, that's always kind of an exciting moment. And I don't usually see people most of my patient interactions are maybe 2 or 3 times, maybe more for our families where we do find something inherited. So then those families we work with more over time. But they're these really cool opportunities to sit down. You get super personal with somebody's family history and talking to them about relationships. And so they kind of lay all this stuff out, and then you kind of parse through it with them and talk about, I don't know, to me, it's all about the human that's in front of me and how this information may or may not benefit them and what they see of value in it, and whether there is value for them, and then working together towards that. So
That's super cool. Yeah, I think I truly believe it's something overlooked. Oftentimes, at least maybe in discussions I've had with students. Bradley, how did the human element, the person in front of you, if you will, how did that impact your decision to be a pharmacist?
Yeah. So I think many folks will think of the pharmacist as the person they talk to when they pick up a prescription. And I think there is such, just like what was mentioned already, where you have to bring these complex subject matters back in a way that is understandable to someone, right? So if I'm talking to a patient about their diabetes, I can explain high blood sugars as like, hey, imagine a hallway, right? And the people are the blood sugars. Now, if you have a lot of people running up and down the hallway, things will get smashed, the walls will kind of get damaged. And over time, that leads to damage in the hallways. And that's the same way that, high blood sugars can affect organs in your body. And so having that like visual, making these really complex ideas from biology and chemistry and all these things that you take back to something that's just understandable to anyone, and helps them better understand their body and what's happening, so that they can remain healthy and continue to live the lives that they want. And especially when it comes to medications, people are very scared, and understandably so, of putting things into their bodies, right? And so trying to help dispel that and let them know, hey, I'm going to be honest with you about the risks as well as the benefits, things you can gain from this, as well as some side effects that can happen, and having a very honest conversation, but letting them know that, hey, I wouldn't be suggesting this if I didn't think that this can help keep you healthy and help you continue to live the life that you want to do, so you can be there for your friends, be there for your family, so you can continue to live a long and happy, healthy life. And so that definitely is a very awesome like human element of pharmacy, is being able to bring these complex subject matters um, in a way that people can understand and feel safe, and let them live happy lives and healthy lives.
Very awesome. Couldn't agree more. Um, Harleen, how did working with people influence your decision either to be an EMT or to pursue medical school?
Yeah, so I think becoming an EMT really taught me that, especially in emergency medicine, the most important thing you can do is to make your patient feel very comfortable. So unlike other clinicians, you might have more time with your patient to, solidify your guys' relationship and really build upon that. And you guys get more comfortable with each other, and the patient's able to, share more with you. But in emergency medicine, we're the priority is to get the patient to the hospital as fast, as quickly as possible to get them advanced, life care. And so so I would say trying to make them feel comfortable is the most important thing. And the way I go about doing that is making sure that I'm, not speaking from a place of judgment, and showing that I'm really on their side, act as like a patient advocate at all times. And I see this was especially important on like calls where there's like suspected drug abuse or a history of addiction. For those kinds of calls, it's really important to show that it doesn't, I want to know what you took. I'm not like with the police, I'm not going to tell them what it was. I just need that information so that we can, best treat you. And so that the doctors and the nurses, they're all on your side as well. They're not going to tell the police about, what you took and who you got it from. I don't need to know any of that information. It's only for your benefit. And so I'd say being a patient advocate is the most important thing you can do as an EMT or as any healthcare provider.
I hadn't even considered that, just kind of how, being on their side is going to be important for you to get the information you need to be able to, make the next call.
Yeah, it's helping them and it's helping you do your job better as well. Yeah.
Wow, I hadn't considered that. That's awesome. Garrett, how did the human element, working with people, lead you into being a physician assistant?
Yeah, so when I was in high school, really liked the science aspect of it. And one of the best things that I was ever told that I should go do was become a CNA, certified nursing assistant. And so one of the, didn't realize it at the time, but one of the requirements to become a PA is that you have to have a lot of patient hours, like at minimum 1,000 direct patient contact hours. Not only for experience, but also reaffirming this is what you want to go do. But during those years of working as a CNA and then transitioning into being a PA, you get countless experience of different patients at stages of their life. I worked in a nursing home facility, and oftentimes it's people that are losing function, whether it be physical function, mental function, and they're in a very vulnerable place, whether you're helping dress them or helping them with simple basic tasks that you and I take for granted at this time, and being very close and the patient having to be vulnerable with you. And now and quickly as I transition to being what do I want to pursue with the rest of my life, I would say that there's a lot of fields in science that you don't necessarily need to interact with people if people aren't what if the working with another person and really that patient focused care isn't really like, this is a really important thing for me. If you don't get jazzed by that, there's so many other fields in science that you don't have to do that. Just large majority probably don't want to go into the healthcare field, at least like the patient aspect, unless you want to be like a pathologist. But now in a day-to-day aspect of it, I mean, there's patients that I see every single day that they're coming in with chronic pain. That's oftentimes what I'm dealing with, some sort of pain. And it impacts, if you think about, if you're in pain, physical pain, it impacts all aspects of your life, and they're opening that up to me. And, realizing that I'm in orthopedic spine surgery and we're having that conversation about doing one of the most vulnerable things, and that's going under the knife, and trying to see if this is the option that we can do, and them putting their trust in me that I have the medical background and knowledge to be able to assess their situation and give them the best potential outcome in terms of my recommendations. It's at times when you step back away from it, it's a really humbling experience, and a really cool, unique opportunity that you get to have. So the when you're in school, it's all like, yes, science and learning about like physiology, anatomy, those sorts of things. But when you get out into the healthcare field, it is so much more people oriented than maybe what people think originally.
Really awesome. Thank you all for sharing your experiences with people, and how it makes you feel, and how you contribute overall. Not just to their physical health, but really just their how they feel in that moment, as they're going through those, as they're working with you all. We got a really good question in the Q&A. I don't know if you all got a chance to read it, but I'll paraphrase. We have a college student who's in attendance, who feels a little bit unsure, right? I think we could all relate to this. And they're kind of questioning, um, if going to medical school, or if higher education in the medical field is for them, because they've heard of how difficult, you know uh, med school is, and they're kind of struggling with their current science courses. So the question leads us to, what do you believe are some of the core characteristics you need in this field? So in the health field, what are the core characteristics you need I would assume, to be successful in this field?
I think, yeah, so I got a chance to read their question, and it sounds like it's a college student. So I was most recently a college student as well. So I'll go ahead and answer first.
Awesome.
Yeah, so you describe, you feel like you're not sure if you have what it takes to go through med school. And I can, guarantee I also I also went through like imposter syndrome first coming into college. You know, I know like a lot of us in this forum here are we're low income first generation students, and I myself was too. So you step onto campus in this really prestigious space where a lot of the kids, they've been it feels like they've been bred for this. It feels like everyone else is so well prepared for these really challenging classes, where you feel like you're putting all your heart and soul into these classes, and you're not really reaping the benefits that other people are, and you're constantly comparing yourself to them. And that, I can totally relate to that. It's a really like sad feeling, an empty, hollowing feeling. But I would say that the most important thing that helped me, push through like the imposter syndrome I felt as a first year when I first came into undergrad, was surrounding myself with other first generation students. So like, finding those peers. So I joined like a floor of just all first generation students, and it was really helpful for me to have find people with my background who I could talk about these issues with. And you got into these universities, you got accepted into your majors, so you're obviously capable of fulfilling those requirements. Like the committee saw what you had to offer, and they let you in. So it wasn't by mistake you got into this university and that you're able to study here. So you should always remind yourself of that. And I think in medicine, even the smartest kids in your classes, they're always questioning, oh, I don't know if I'm good enough for this. And that's really good. I don't think anyone should be thinking, I'm built to be a doctor. I think that would I wouldn't want a doctor who's so pretentious as that. So I think it's good you're questioning your ability, and you're questioning whether you're really cut out for this. I think that's a good mindset to go into medicine with. And to finally come back and answer your question, your core characteristics that you need, I think, I think you really need to have a passion for people, and to really care for your community, and be that patient advocate. And then also it is important to really like the science classes, and to enjoy learning that stuff. Um, yeah, that's as much as I have to say. Thank you. Sorry, that was a very long spiel.
No, no, great response. Anyone would like to add either to the, how do you know if this field is right for you? Or what are some characteristics that you need for this field? Anyone want to chime in on that?
Yeah, I can chime in real quick. I will say that if you are going to the medical field because you want to help people, um, I don't think that should be enough because I think there are plenty of other people that help people. You don't have to be in the medical field to help people. And I think that's very honest and like that's very real. And so I don't want you to feel that this is the only career path that helps people. Um, Now there's many paths to the same goal. And similar to what I mentioned earlier, it won't be so much why you chose it in the first place, but choosing why you continue to do it. And that is a continual process because even, we are here on the Zoom call and I think it's still a continuous process of us, do we still want to be in here? Is this still for us? And so I think it'll be a lifelong journey. And if you don't know what to do or, what gives you passion, I think there's one question that I have kind of gravitated to and I tell folks who are struggling with this as well is, what in the world makes you angry and that you wish you could change? And if you really sit with that question, I think you'll find some sort of passion in somewhere. And hopefully, that leads you to wherever career that you feel like you belong in. And that'll be a lifelong journey because you need to continue to ask yourself, is this what I want to do? Because you can change at any point in your life just because it's past, 4 years out of high school, 4 years out of college, 4 years out of your second job, or even, after you have a family or things like that. You can always change what you want to do. Nothing has to be set in stone.
Thank you for adding that, Bradley. Anyone else want to add to that? Any personal experience with maybe questioning yourself or thinking, is this right for me? Should I be in this field?
I'll echo Bradley's statement that I do feel like often we at the beginning feel like this is a final decision, like what I choose to do or the path I take right now, I can never turn back from. And obviously there are moments that make it more difficult to change and to reverse course, but there is a lot out there that's exciting and that can, lots of paths that you can head down once you start down one that you can't even see right now. And so I think that sometimes we get a little paralyzed because we want to make sure this is the right path. I did not get into genetic counseling school the first year I applied. And I was working as a lab manager with cyanobacteria, and I hated it. And I was so miserable. I was like, this was not what I wanted to do with my genetics degree. I was making competent cells out of E. coli. It was terrible. Maybe somebody out there loves it, but I did not. And so I'd reached a point where I was like, I didn't know what I was going to do after I didn't get in. I was like, I needed to start thinking about other paths. And I looked at nursing programs in genetics. I looked at kind of revisiting being a science teacher, and I kind of made some smaller goals and did some volunteer work. I worked at a hospice for a while, just trying to find like what made me feel like I was contributing to the world, because I wasn't sure that what I thought I wanted to do was going to pan out. And I mean, I'm lucky that it did, and I'm happy that it did, but it also helped me realize that there were a lot of places I could apply the skills that I developed up to that point, where I could still give good things back and feel good about what I had done in a day. I didn't have to be stuck in a lab, which is what my degree kind of had left me, right? I didn't have that many options at that point, but I was able to see some other pathways where I thought I might end up if things hadn't fallen into place that next time I applied.
Thank you for sharing that. And kind of in summary, what I heard from the panel in that regard is to remind yourself that you're capable. Question why you do it. You know, maybe talk to someone in that field, get experience, and some of it will be trial and error, figuring things out, trying things out for yourself to see. I've really enjoyed getting to hear from our panelists. Students, please join me in giving a virtual applause to everyone who was able to join. And to our panelists, thank you so much for taking time this Thursday. I wish you all health and safety and a great weekend.